Hello, everybody. It's Dr. Anthony Cave, live and unscripted. And I'm going to tell you about patients that come to me about once, sometimes even twice a day with a bag of supplements. And they are so excited to share with me what is the latest supplement that they have that's going to fix all of their medical problems, that panacea pill that isn't in mainstream medicine. Hey, I am all for alternative evidence based medical treatments. I've done a fellowship in integrative medicine in addition to the Stanford Harvard anesthesia training. I am all for what works for patients. I'm not for things that don't work, are unsafe, or rob patients of money because patients are vulnerable and they deserve the best care. And that includes care for themselves as a whole, their medical situation, their psychosocial situation, their family situation. And if the average patient that comes in with this bag of supplements, which happens, not just vitamins, not just herbals, you name it, I have seen it. And it might be costing them $200, $300 a month. That takes a toll on the patients that I care for. I don't know about your patients, but it does for me. Microdosing is just one of the many hot things that comes up here in the San Francisco Bay Area. Patients always ask me about microdosing for psilocybin, for LSD. But today, we're going to talk about ketamine. And as you know, I also direct a ketamine infusion clinic. I use ketamine nearly every day. Powerful, powerful medication when used responsibly and ethically, transformative for so many patients. Can also be a waste of time, waste of money, waste of resources, and a source of false hope. So, microdosing ketamine. Let's jump right into it. I first want to say hi to Allie, Sherry, Heidi, Alexis, Pat, Sarah, Linda, Grace, Z, Martha. Great to see everyone on here. And I appreciate everyone's happy wishes. And yes, happy early Easter to everyone. Microdosing is this really vague, non-specific, almost a marketing-like term, where we use a low dose of a medication or a substance or a supplement, whatever, maybe 1/5 to even 1/20th of the quote normal dose, hoping that it'll give us a benefit with lower dose, so maybe it's safer, and we use it more frequently. So maybe instead of, in the case of ketamine, once weekly infusions, we would take oral ketamine every single day. And that might give us the same benefits without the same perceptual changes that ketamine gives. Now, those are the three elements to any type of microdosing for LSD, for psilocybin, and even for ketamine, where we hope that it's going to give us benefits. And they're often going to be cognitive performance gains, not necessarily to treat a particular situation or a particular condition. This is the hallmark of microdosing. Now, in the case of ketamine specifically, this would sound great because ketamine infusions work very powerfully when done responsibly. You can see my videos on how we practice and what you need to look for to not get scammed by ketamine infusion clinics, of which there are so many. And yes, many, many patients come to me after trying them, and the experience is totally different. And they're like, wow, I didn't know I was missing out on a true holistic ketamine experience. But in the case of microdosing, maybe you could bypass the infusions because they take time. You have to drive out there, someone has to drive you back. Maybe you can get benefits. You don't get the same visual changes. I mean, there are perceptual changes with ketamine infusions. What's there not to like about this? And it's cheaper because a little pill of ketamine, a very, very low dose, would be much cheaper. So microdosing evangelists have really pushed this marketing. And there's so many companies. You can go online, mail order ketamine microdosing companies, plenty of them. On top of that, ketamine is actually quite safe at those very, very low doses. And you're unlikely to have a large legal exposure because things are unlikely to go wrong. So it's like this perfect setup for marketers to take advantage of vulnerable patients. Well, here's the issue with microdosing. I'm not against microdosing for certain substances. Ketamine is a different story, though. The problem with microdosing is that, number one, safety. In terms of physical health, you're probably not going to have a major issue. Of course, things are possible, but these are such low doses, realistically, that when they go through their medical screening, it's unlikely that something is going to come up that's going to be immediately lethal. But of course, there are risks. However, the problem is that microdosing doesn't actually have any evidence. There's a little bit for psilocybin. Some studies are positive, some studies are negative. In some of the studies, it looks like the anticipation and the placebo response might be more powerful than the effect itself, but the jury is still out for psilocybin. That is the psychedelic compound found in mushrooms. For ketamine, there is virtually no evidence on microdosing in humans. There's a study in rats, and there's a study in mice, and I have links to this on my website, and they show maybe some positive, maybe positive effects. But if if I have a patient who's struggling with treatment resistant depression, isn't getting out of bed, can't hold a job, isn't participating in any social interactions, giving someone a false hope that low dose ketamine is going to solve all their problems might produce more harm than good because they're not getting access to an appropriate treatment. Now, of course, more goes into determining who's a candidate for ketamine infusion therapy, but you can't just jump to microdosing. Now, there's other issues too because of the concept of tolerance. Ketamine, like psilocybin, like LSD, has an element of tolerance. Just like with opioids, by the way, quite frankly, with almost any medication, this is really important because tolerance is going to affect what dose you need to achieve a response. Tolerance is when you need increasingly higher doses of a substance to achieve a response. So, for example, on day one, somebody gets an oxycodone, let's see, 2.5, something very, very, very small. And they begin to use it for a week. And after a week, it's like, wow, they need to take 5 to get the same level of pain relief. And eventually 7.5 and up and up and up. Same thing can happen for LSD and ketamine as well, and psilocybin for that matter. So if someone's been taking, let's say, psilocybin, where it's been studied, granted, these studies are from the 1960s because of war on drugs that has prevented a lot of research on this recently. But point is that it doesn't matter. You might need a certain dose on day one, but after day 30 of microdosing, what about your dose requirements then? Maybe your microdose has gone from 1/20th now to maybe 1/10th, but you don't know that. Not only because of the tolerance issue, but also because we don't have good ways of measuring substances that are illegal. In the case of psilocybin and LSD, how do you really know the exact dosage you're getting? In the case of ketamine, we have a little bit more control because ketamine can be legally prescribed with a DEA license. So you can be precise about the dosing, but what about the tolerance still, in the case of ketamine specifically? So it's not by accident that mail order programs are pushing this because it's much cheaper for them. You don't need to have a holistic approach the way you should have for any type of psychedelic experience with a preparation phase, with an integration afterwards. All of what makes this whole psychedelic experience powerful is not the psychedelic necessarily itself, though that is a powerful part of the greater experience. If you want the sustained benefit, remember, it's a persistent change in self representation, which is what underlies the enormous benefits to some psychedelic experiences, medically supervised, of course. To get persistent changes in self representation, the persistent rarely comes from just popping a pill. If that were the case, it would be so easy. But it comes from a lot more, but a sub perceptual dose, a microdose of ketamine, just popping that pill, hoping it's going to replace your sertraline, your Zoloft, your fluoxetine, Prozac, your Wellbutrin, whatever. This is a ripe setup for a potential scam. Not all providers are going to be intentionally scamming, but I do have very, very high concerns because of the lack of evidence and because of everything we're sharing. It's like a little loophole to try to potentially take advantage of vulnerable patients. With that said, there are good companies out there trying to do good work. I don't doubt that. But if you're the consumer, if you're the patient, I want you to be empowered to advocate for yourself and hopefully not fall victim to these scams. You have more power over your health than you've probably ever been told. And knowing safe sources, so you're not walking in like one of my patients with a bag of supplements, just being robbed of money every month, is going to help you longer, and it's going to help you give those persistent changes in health. That's what I hope you learned from me. Thank you so much. We're going to jump in to the questions and answers that I promised, and so many great questions. Oh, thank you, Heidi, for the kind comments. Courtney, looking forward to having new experience microdosing or otherwise trying ketamine sooner rather than later. Courtney, I wish you the best as well. Diana, great seeing you for the first time on live. Healthy Healings, Chris, very accurately calls us capitalism at its best. We don't have to get political here. There might be a role for capitalism in medical innovation. However, unregulated capitalism is very different than having a capitalism that promotes compassion. I would hope to say common sense, but also recognizing the vulnerability of patients that are participating in the system. You can't safely have a pure capitalistic model and expect patients to not get hurt. Linda Lou, I haven't seen you on here before. I'm wishing you the best for your fibromyalgia. Linda asks, what is a normal dose when you get a ketamine infusion? That dose varies substantially in my personal experience when given intravenously because of the effects of tolerance, because of perhaps the history of use of other neuropsychiatric medications, perhaps because of whatever the history of trauma, whether they were adverse childhood experiences, whether it was a physical pain or an emotional pain that is otherwise, maybe adolescence or young adulthood. These things likely interact with what we believe is ultimately going to be the right dose for the patient, and it varies. We start at 0.5 milligrams per kilogram, but that number can easily more than double depending on the individual. Very good question. Denise, good to see you on here as well. And Linda is already commenting that she's had drug tolerance before. And certainly I'm sorry that you've experienced that, but you know that it's a very real phenomena for anything we put in our body. Another reason why external loci of control need to be scrutinized at the very least. The inner healing potential, however, as far as I'm aware, doesn't appear to have as much of an effect of tolerance as external loci of control. That's, for example, gratitude practice, internal loci of control, versus Ativan. Nothing wrong with Ativan at the right time, at the right place. But over time, there are concerns. I am Devil Woman. Good to see you. I'm sorry to hear about all of your snow in Minnesota. Chris brings up a good point of who you're buying substances from that you're microdosing. It's a huge concern, absolutely. Faye is asking, what is ketamine? Ketamine is a very powerful anesthetic. You should watch my other videos on that so that you, it's too long to explain in a question right now, but I highly encourage you to look into it, especially if you have been struggling with mental health conditions like depression, anxiety, chronic pain, or PTSD. What does ketamine have to do with neuroplasticity? Asks Rachel Warner. Good to see you on here. It does increase neuroplasticity. So, for example, if you come into the operating room with me, I use that example a lot because I'm filming in the operating room a lot, as you've seen, and you have this trigger from the smell of the oxygen mask, the operating room lights, maybe the paint color in these sterile hospital environments. That might be a trigger to you. It goes through your eyes, ultimately through various projections through the thalamus, etc., to cause a change in your central nervous system. It's really powerful what a trigger really is, an external source that doesn't touch us per se, but profoundly affects our central nervous system. There's an element of learning in this, right? Because you typically don't get triggered the first time. It happens on repeat exposures. Kind of similar to other drugs, by the way, but putting that aside, when you have a neuroplastic intervention like ketamine, it might provide an opportunity to hit the pause button on the trigger coming into you and eliciting that response in your central nervous system. I had a whole video you could watch it on how neurons that fire together wire together, one of the concepts behind neuroplasticity. But ketamine, like other psychedelics, does have this ability to help promote a new habit from forming, to break old addictions and allow us to form new ones. And by addictions, you could replace that with rigid cognitive loops, of which triggers are one. Very good question. Shirley, good to see you on here. Steph, my pleasure. Kevin Raymond Jackson Jr. Do I have any experience with psilocybin for PTSD issues? I can't comment on that. It's still illegal, but you can certainly look at many other studies that are. I have not. I don't. Can't use psilocybin in California because I would get in trouble. But there are certain exemptions. People that are doing this in other states, particularly at Johns Hopkins, you can see their data on PTSD. Likely will have some benefit there, I would imagine. But for ketamine and trauma, I can discuss that. And that's similar to what we talked about for the trigger. If a traumatic memory that's brought up, if we can help, if we can interrupt that loop of the thought eliciting the change in your blood pressure, heart rate, sweaty palms, dilated pupils, heart rate variability, etc., if we can break that connection, it offers a potential, perhaps as part of a holistic plan, to address PTSD. By the way, similar to what beta blocker therapy does. Very good questions. Where does the FDA stand on microdosing? For ketamine, you can do whatever you want. It's an FDA-approved medication that can be prescribed with a DEA license. For the illegal psychedelic compounds, of course, microdosing or macrodosing, they remain illegal at the federal level. Does this work for panic disorder, asks Deb. Similar to what I described for PTSD, there might be a role. Absolutely. Caliber, good to see you. Do I know if sertraline can cause TMJ disorders? Caliber, I'm not aware of that. Al Gunter, I know this isn't microdosing, but when I broke my back on a transfer, oh my gosh, I'm really sorry about that. They gave me ketamine in my IV without telling me, and it was by far the worst experience in my life, PTSD from it. Al Gunter, I'm very sorry that you had that experience. Do recognize that a large dose of ketamine used to sedate a patient without concomitant midazolam can absolutely cause horrific experiences. When we're talking about ketamine for treatment of mental health conditions, we're talking about very, very different doses. Great question. Aaron, does it matter if you're using racemic or S? So there's racemic ketamine. That's keep in mind that R ketamine is not racemic ketamine. S-ketamine is referring to one of the enantiomers. One of the common tricks played by Big Pharma that you should be aware of. I have a whole video on this about patent extenders, Me Too drugs, look-alike drugs. Very, very big concern because you, the patient, are paying for all of these Me Too drugs to go through the approval process and for the ads that you are being advertised to in the United States in particular through direct-to-consumer advertising. But same applies to S-ketamine. We don't have any evidence for microdosing. Good question, Aaron. Shirley, there's also don't mess with what's working. If the patient isn't overdosing, okay, so Shirley brings up a good point. Don't break what's not broken. Your question disappeared from my screen here, Shirley. But I agree. If a low dose works, we want to avoid higher doses. I absolutely agree. By the way, I would appreciate if you guys who are watching do hit that like button to support what I'm doing. As you know, I don't want to do product placements ever if I can help it, because I believe that the greatest healing potential comes from you, not from an external loci control, with few exceptions, of course. But it helps support me to do this more often, and I really appreciate empowering patients so that if they don't need to come to me, all the better. I will find a different job. Amist Oasis, good to see you on here. I think it's your first time. Question, she asks, do you have a video of someone having a ketamine infusion? Not yet. It's in the works. It is in the works. I can't wait to actually demonstrate what it's like. It's a very powerful sacred experience that I'm very much looking forward. I have videos of me intubating patients with propofol infusion, not with ketamine infusion. You can check those out. And say, okay, so I am looking at the Kate Lewis. It's not on our public system. Very expensive in Australia. Yes, ketamine infusions are also expensive in the United States. Something I ask patients, and this is a very serious point because it breaks my heart if I have a patient that can't come to me because they can't afford the out of pocket cost. I also do need to raise the competing concern, which is what has insurance done for you so far? How far have you gone with your insurance? Oftentimes, for the conditions that I'm treating, insurance doesn't cover it. And I do plenty of work, by the way, without compensation outside of insurance. All those phone calls that I make to patients before anesthesia, the night before, none of that is ever covered by insurance. I'm not saying, and to be very clear, I'm not a saint here that's doing, no. I believe in doing the right thing for patients. And I recognize that the current medical system in the United States does not compensate for doing the right thing, which is why my personal clinic outside of insurance gives me an opportunity to give the care the patients deserve. So it is a fine line of balance. And yes, I do have a compassionate care program within that as well. I'm sorry that it's expensive in Australia, Kate. Eva, good to see you on here. How long should someone be on ketamine? That's a very good question. I don't ever prescribe the oral ketamine. I do the intravenous ketamine. And our goal is to hopefully have patients complete their induction of ketamine with 6 sessions, maybe 10, depending on the individual, and not need ketamine again because of the persistent changes in self-representation. That being said, if someone needs a booster every 3 or 4 months, that's the equivalent of 3 or 4 infusions a year. In many cases, and not all, and this is going to be an individual decision for every patient, I believe that is often safer than having a psychiatric medication taken orally every day for the rest of one's life as a destination therapy. Another thing that the pharmaceutical industry never talks about with patients, and subsequently doctors don't talk about with patients, is the difference between bridge and destination therapies. I have it in one of my upcoming videos. You should absolutely always be thinking, whenever a doctor is giving you a pill, you should be asking, is this a bridge therapy or a destination therapy? Very, very good point there, Eva. Until next time, you have more power over your health than you've probably ever been told.